Life is all about the gray area undefined. Life is filled with parallels. You can have your cake and eat it too. You can choose to live your life out loud, or you can choose the in between or the middle of the road. Inside the gray area, that's where life happens. Welcome to Inside the Gray Area, sponsored by McGregor. I'm Leanne O'Brien, representing McGregor. I'm here with Elizabeth England from the CAS Company. The CAS Company is a group of insurance agents that help individuals select their choices for various Medicare plans. So now we've talked about Part A, Part B. You've mentioned Part D.
Yes.
Are there any other parts we need to know about?
Yes, we need to know. You need to know about Part C. Okay. Part Medicare Part C Advantage plans. All right. Um, they combine your Part A and your Part B and your Part D all into one plan, Part C, Medicare Advantage Part C plans. Um, they are managed care plans, which means they are an HMO, a health maintenance organization, or they are a PPO, preferred provider organization, and they would most of them, a large majority of them, you can get for a zero monthly premium. And I think I forgot to mention about the Part B premium.
Okay.
There is a premium for Part B. There's none for Part A, but there is for Part B. And on average, it's $174.70. And they look at your a month.
Yeah.
And they look at your income from 2 years ago to see what your Part B premium is going to be. So you can do a Part C Medicare Advantage plan as long as you got A and B, and you can get a Part C plan for zero monthly premium. And then you get additional benefits that are not covered by Original Medicare. Original Medicare does not cover dental, vision, hearing.
Right.
All right. You enroll in a Part C plan, you'll get dental, vision, hearing, over the counter, Kellogg, silver sneakers,
Right.
a free gym membership.
Yeah.
Everybody loves that. So there's extra benefits that you can get. And my clients, they love their Part C plan. They get all these extra benefits and at zero cost. They just have to, make their Part B premium payment.
Do you ever have one plan and not another, or is it always
You
A,
can
B,
only have
C?
one plan, or you can only have one plan at a time.
Okay.
So if I have somebody enrolled in a plan right now and they want to make a change, that previous plan will get kicked out, and Medicare handles that.
And they can only make changes at certain intervals?
Oh, very good question. You can only enroll in Medicare at certain times.
Right.
All right. Um, so, and that's what a lot of people 65 and older, it catches them by surprise.
Right.
You know what? Right. So I think I mentioned earlier that you have this initial enrollment period, 3 months before your birthday month, and 3 months after. That's your initial. All right. And no, the Medicare is not going to contact you. But your clue is you're getting all this mail from the insurance companies.
Sure.
You might even get something from me.
Okay. Well, that could be a good thing.
Yeah, yeah. So we all know you're turning 65. Yes, no secret. So that's the clue. All right, that it's time to enroll.
Sure.
And people will come to me and say, well, what do I need to do, and blah blah blah. And then we have the conversation that you need to contact your local Social Security office and sign up for Original Medicare Part A, Part B. After you do that, then that's when I can help you find a supplemental plan to help you get benefits that are not provided by Original Medicare, the dental, the vision, the hearing, the silver sneakers, the over the counter, those kind of things. So, and then we'll look at different plans based on your medications and your doctors. We'll look at different plans.
A lot of people talk about, oh, all of a sudden I'm getting AARP letters in the mail, and information about that. That's simply another opportunity of a plan, or talk a little bit about that.
Okay. AARP is not an insurance company.
Okay.
Okay. They are an advocate for seniors.
Sure.
Okay. AARP endorses United Healthcare. United Healthcare is the insurance company. So people call me and they say they want AARP. I says, it's not an insurance company, but United Healthcare endorses it.
Mhm.
But that's the only carrier that they endorse. So I mentioned I represent 10
Mhm.
different insurance companies. We're talking about United Healthcare, Medical Mutual, Anthem, Aetna, SumaCare, WellCare. I'm sure I'm missing some other ones, but
But there's a lot,
the,
yeah.
oh, there's even more. I'm just licensed and certified
Mhm.
to market those products for those insurance companies. You have to be a licensed agent. And also, I have a non-residence license in 15 different states.
Which is good because we have some individuals that have, homes in other states
And
and they
relatives.
disappear from Cleveland in the winter months and go down south.
And
So that's important.
that's exactly how that came about. Is somebody here in Akron I helped. They referred me to their relative in Pennsylvania. They call me up and say, so and so said I need to talk to you. And then it's if they're interested, then I can get a non-residence license for that state.
Mhm. What other things which should we consider when, that subject comes up, when we're nearing that 65 or beyond, or maybe somebody postponed doing anything until they're 70 because they want to maximize their Social Security benefit and so forth. So,
Correct. And you bring up a good point. So your Social Security benefits, the money that the check that you're going to receive
yeah,
from the Social Security Administration, that is its own program. And you can get your money from anywhere between age 62 and 70. All right. Medicare is a federal health insurance program that you're eligible for when you turn 65. Okay. So you don't have to wait for this to do that. Okay. So when you turn 65, you're eligible for Medicare. Boom. No pre-existing condition clauses apply, nothing. They'll take you just as you are. Isn't that wonderful?
that is. That is.
12,000 baby boomers are turning 65 every day.
Yes, I know. That's a scary thought.
That's a scary thought, and that's going to go on for another 4 or 5 years.
Yes.
So Medicare, and that we said it already, Medicare is not going to contact you. You're 65 years old. I think you need to take a little responsibility for your health care.
Yeah.
I mean, I worked at, corporate America, and my employees, they got used to the benefits HR person.
Sure.
Well, Medicare they don't hold your hand like that.
Right.
You're going to have to be a little more proactive. You're going to have to ask questions and get with people that are knowledgeable about Medicare, and don't be afraid to ask questions.
Mm-hmm. Let's talk about premiums because nothing in the
Okay.
world stays the same
Mm-hmm.
over time, year after year.
Right.
So, do premiums go up every year, or what can an enrollee expect?
Good question. So there are different types of premiums. First is your Medicare Part B premium. All right, that when you sign up for original Medicare Part A, Part B,
Sure.
you have a Part B premium. That can go up, that can go down. We usually don't know till November sometime.
Okay.
Okay, so right now it's 174.70. Last year it was higher and everybody complained and they dropped it down, and now they're probably going to take it back up. So they can definitely need to budget for that.
Sure.
That's when
That's coming
when
out of your pocket.
it's coming out of
yes.
your pocket, and that's when the financial advisors,
Right.
they refer me to their clients so they know that is going to be an expense that will not go away.
Right.
As long as you keep original Medicare.
Mm-hmm.
Now, if you enroll in a Medicare Part C plan, a
Mm-hmm.
Medicare Advantage plan, your monthly premium can be zero. Okay.
And how does that happen?
The government, the government has a contract with these insurance companies. And so your Part B premium that you pay 174,
Yep.
the government is paying that insurance company money to provide you with the benefits. So they're getting money on your behalf.
Okay.
Okay, and they want your business. Remember, I told you they're sending all this stuff?
Yeah.
They get a nice check from the federal government every month to provide health insurance benefits to you.
Okay.
So that's how they're able. As a matter of fact, part of their contract with Medicare is that they will provide preventative care, dental, vision, hearing, the keep people active, the free gym membership. So
Right.
that's part of the contract, is that people are living longer. people are more active, seniors are more active, and so that's why they're able to do that. So they
Right.
can give you a 0 monthly premium plan, or you can enroll in a 0 monthly premium plan. But when you actually receive care from a provider, you will have to pay a copay. Okay. Primary care physician, I don't care what plan you get, is zero copay. Because we don't want any barriers for you to go see a doctor.
Right.
You know, people, I didn't have 25. I ain't got-" Okay. Zero.
Right.
Go see your primary care physician, and there's a list of preventative care services that all the plans cover. So your mammograms, your colorectal screenings, your vaccines, it's a whole list. I tell my clients, take the book, because they're going to get an enrollment guide. Take the book to your doctor's office and say, I can get any of these screenings at zero copay. Which ones do you recommend that I get done now?
Mhm.
Okay, so that's a zero copay. When you go see a specialist, so we're talking about a podiatrist, an ophthalmologist, those kind of specialties.
Surgeon, or
Well,
is that
surgeon, hold
something
on.
else? Okay. All right.
So
Go.
you have a copay for when you go see a specialist.
Gotcha.
Then you'll have a copay if you go to the hospital. It's an inpatient copay, and that will cover your surgeon, your hospital stay, and those kind of things. And $200-300 per day for days 1 through whatever. So all those kind of things is what we'll talk about when we're looking at a plan for you. They're pretty much all the same. I'm always looking for game changers. Some plans will give you the personal emergency response system. If I fall in and I can't get up,
Yep.
yeah, some plans offer that. Some plans give you extra dollars towards dental, vision, hearing. So I get to, so I check with my clients, what is it that you're looking for? What are you looking for in a plan? Do you need more dental? Do you need more vision? Do you need more over the counter? I don't know. So we got to talk, and then we'll compare generally 3 plans, and they can let me know. We can go from there. And it's always the client's decision. It's not my decision.
Right. Right. You're
Yeah.
just there to
I'm just there to
educate them
facilitate. Right, right,
on
right,
their
right, right.
choices and options. So, and when you're considering premiums, does it kind of work, like some typical insurances work where 80% is covered, but the 20% you're responsible for? Does it fall into a 20% range? Is it more of a flat fee? What's the percentage on that typically?
All right, good question. So when you do original Medicare, it is an 80%, 20% split.
Sure.
Medicare pay 80% and you pay 20%. And there's no maximum out of pocket. And as long as you incur claims, Medicare, long as it's medically necessary, Medicare will pay 80% of that claim cost, and you're responsible for 20%. If you do a Medigap plan, which we haven't talked about, if you do a Medigap plan, um, they will pick up that 20% for you. Okay, so you pay a private insurance company a monthly premium. We're talking about premiums, right?
Right.
You would pay them a monthly premium, and they will pick up your 20% cost. A lot of people like the Medigap plans because there's no network. You don't. It's no in and out. It's just any doctor that accepts Medicare. Okay. The only, but I hate to say a downside, but when you do a Medigap plan, you don't get any additional benefits.
Mm-hmm.
You just get what original Medicare offers.
Right.
Okay. And so, like I said, a lot of people like it because there's no network, but they don't get the extra benefits that I talked
No.
about with the Part C plan.
Right. It just might help you on the back end with the premium. Yeah.
Absolutely.
Yeah.
So then you'll have your Part B premium, you'll have your Medigap premium. You would have to purchase a standalone prescription drug plan. So those are your costs.
Mm-hmm.
And if you do an Advantage plan, you have your Part B premium and a premium for the Advantage plan, but it's usually zero.
Sure.
Zero.
Yeah.
And then you pay your co-pays as you go. So when you encounter the doctor and you have services, and a lot of people are familiar with that because that's how the group plans are.
Sure. Yeah.
You have a
Right.
copay when you go and
Right.
such. So I tell people, I says it's like your group plan. You go see the doctor, you pay a copay. Show them your ID card, pay the copay that's required, and the doctor see you, and then that health plan picks up the rest because they're getting that money from Medicare.
Sure.
So
Yeah.
they'll pick up the rest of that claim cost.
Good. Good. Well, you've been a wealth of information. Is there anything that we've missed? I'm
Well,
sure there's so much. We can go on and on for days.
we can go on and that's why, some people, they try to figure it out themselves. And I'm like, have at it. But, there's no cost or obligation to work with
No.
me or any
Right.
agent. We do all the legwork. We're the boots on the ground, and we can help you navigate through the Medicare maze.
Right.
Yeah.
Yeah. Well, thank you for your information today. Thank you for joining our Inside the Gray Area podcast. And I'm sure we'll, see you in the future. We are hoping to have a few programs lined up here at McGregor, so we'll look forward to that.
Well, great. Thank you.
Thank you for joining Inside the Gray Area. We're here to answer all your questions and share some interesting insights. I'm Leanne O'Brien. We look forward to seeing you next time, and be sure to follow us on social media and our YouTube channel.